When people ask me what I go to school for, I tell them HIM. They then ask me, what is that? Health information management is HIM. Health information management also deals with the business aspects of healthcare. That's what I normally say to people who have no knowledge of the healthcare system or anything that deals with health information management. By the business aspects of healthcare, I mean that there is no direct physical contact between the health information manager and the patient. We do not deal with the hands-on things that doctors and nurses deal with. However, we do deal with patient care because we're part of controlling the medical record. Health information management deals with the practice of acquiring, analyzing, and protecting digital and traditional medical information to provide a better quality of patient care. The whole purpose of this is so that patients receive better care when they're at the hospital or an outpatient or a doctor setting. As a health information manager, you can work in a variety of different settings. You can work at a hospital, you can work at a doctor's office. You could not work at either of those. You could work somewhere that deals with medical records and scanning and putting in place a good system for doctors or hospitals to keep their medical records. Or you could work with computers and be an IT specialist, deal with data analytics, or building databases. Or you could be a coder and code from home. You don't have to work in any of these specific settings, or you don't even have to do any of these jobs. These are just some examples. The job of a health information manager is to build a bridge between all functional, clinical, and administrative aspects of the hospital, or for that matter, any of those other settings that I said previously. You build the bridge between all these people because you are ultimately in charge of the medical record. Your job is to keep that record safe and secure so there's no breaches of any type of confidentiality. You are in charge of making sure that the health record is in the right place at the right time, and so that the doctors and clinicians and patients for that matter have all the right information at all the right times. You build the bridge between the doctors and the insurance companies, doctors and the patients, and just the patients and their medical records. Health information management is a pretty cool major. There's no set in stone thing that you can be when you're done. You can do anything. I personally am not a fan of computers, so IT is not for me. Coding is really interesting to me, so I think that that's what I'm going to be. And when people ask me what I'm going to be, that's what I normally tell them. But being health information manager is a career that deals with patients, it deals with hospitals, it deals with medicine, and it deals with a lot of security and legal things. So hopefully this explains health information management a little bit better.